Happy Day M.O.P. Warm greetings from the Student Ministry of Health and Hygiene M.O.P SANSAD 2025-26. Every year, we focus on spreading awareness on various health-related causes through our events and campaigns. This year, our flagship In Sync campaign is centered on the theme Menstrual and Mental Health, reflecting our commitment to fostering awareness, education, and open dialogue on these vital aspects of overall well-being. By bringing this theme to the forefront, we seek to promote both physical and emotional health while addressing challenges that are often overlooked. We are privileged to have with us today an eminent expert in the field of gynecology whose insights will add great depth to our understanding of this important subject. We have with us Dr. A. Jaishree Gajaraj, Senior Consultant in Obstetrics and Gynecology. With over 35 years of experience, she specializes in high-risk obstetrics, preventive gynecology, menopause management, and adolescent health. A fellow of both the Royal College of Obstetricians and Gynecologists and the Royal College of Surgeons in the UK, she has also contributed to public awareness through TV programs, health initiatives, and numerous articles in women's magazines. We welcome you to M.O.P Vaishnav College for Women, ma'am.
Thank you.
Before we begin, I would like to mention that the questions we have prepared today represent the voices and concerns of the student community, ensuring that the conversation remains relevant and meaningful. Doctor, how does our mental health affect our menstrual cycle and what are its consequent effects on our body?
To begin with, thank you very much for inviting me. It's my pleasure to be part of this program. Mental health, I think, is a word that nowadays seems to be a buzzword because all of us are saying we're stressed, we are under pressure from what I don't know. Now, how does it affect? Yes, it does affect our day-to-day life in a big way. But as young girls, as young women, it definitely affects our menstrual health because menstrual health itself is a product of interplay of a number of hormones. And these hormones are all produced in the brain. And the brain is where most of our stress is reflected. So indirectly, there is an interchange or an interplay of these hormones and an imbalance comes into the picture. Therefore, definitely menstrual cycles become irregular, menstrual flow can become heavy, women can stop having periods also. So in many different ways, the day-to-day stress actually affects the menstrual cycles.
It is often said that menstrual cycles are not inherently meant to cause cramps or uterine pain. However, in reality, most individuals do experience such discomfort, raising the question of why this has become a common issue today. Is this normal or does it require medical attention, ma'am?
Okay, so to begin with, this belief that menstrual cycles should not be painful, I think is not entirely true. Now, nature has made it in such a way that menstrual blood is actually thin. It does not come out in clots. So that is nature's way of ensuring that the flow is maintained. But when the flow becomes excessive, then you start getting clots, blood clots. And for the uterus to push out these clots, it has to contract and therefore you get cramps and therefore pain. So it is an indication for us as doctors that maybe if this person has pain during periods, it could be a reflection of heavy periods. That is one. Secondly, just prior to the periods, there's a lot of blood flow in the pelvis, a lot of blood flow to the uterus. So there is something called congestion, pelvic congestion. Now this can also give rise to a lot of pain. So it's a combination of factors. If it is sufficient to disrupt the person's individual's day-to-day life as in during the periods, then certainly they have to go and see a doctor. There is no need to put up with it saying periods are painful, that's okay, just go ahead with it. They can definitely go and see a doctor and get relief.
Yes, ma'am. As we are in the conversation about pain, I wanted to know if there's a difference between period-related pain and endometriosis-related pain, ma'am.
Yes, there is a difference. At the same time, there is a connection as well. Now, normally what happens before a period, there's a lot of blood flow to the pelvis and to the uterus itself. So you get this pelvic, the period related congestion and therefore pain that happens during the period. Now, this pain actually results in cramps. Now, endometriosis is a slightly different entity. The normal lining of the uterus that is shed during a period can also be found around the uterus on the ovaries and generally all over on the environment in the pelvis itself. Now, this also tends to respond to the monthly cyclical hormones. When this happens, it grows, and therefore there is a pain which can start even a week or 10 days prior to the actual menstrual flow. So, endometriosis related pain will occur before a period itself and continue into the period, whereas a period related pain is only at the time of the flow and it stops as soon as the bleeding stops.
Okay, ma'am. Speaking of pain, what is the healthiest way to manage the period pain? Is it okay to rely on painkillers or are there any safer long term options available? Similarly, is it safe to use medicines to postpone or delay the periods for events or travel, ma'am?
Okay, so you've got two parts to this question. One is, should we put up with this pain? Now, basically, the management of this pain starts from the very beginning. As soon as the child attains menarche and starts having periods, that is the time we need to educate her. The mother and people around her have to first make her understand that menstruation is a normal phenomenon. It's something she has to probably go through every cycle till she goes into the menopause. Menstruation can be heavy, menstruation can be painful. So we kind of develop a positive attitude towards this even from her teenage. So this helps her to cope with the pain. That's a first step actually. Secondly, as she grows older, if it in any way compromises her activity, like attending school, attending college, or even going to work, then we need to actually investigate first. Find out whether there's any reason for the pain. Now, if there is no reason, then again, painkillers are definitely allowed and permitted. There is no need. I mean, sometimes a timely single tablet can take care of the pain for the rest of the 3 days. So there is no need to deny, there is no need to tell her that, it is normal, so put up with the pain. She can have painkillers, can get relief because remember at the end of the day, 3 to 5 days in a 30-day month is a lot of productivity loss. So yes, we need to get on with our lives and we need to be comfortable. So there's no reason at all. The second part of your question, is it right to postpone periods by taking medicines? Generally, I don't think it's a good idea at all. It is not good to interfere with our the hormonal cycles that take place. Now, if there is a very important event where we know either religious or social, where the woman should not menstruate in inverted commas, because we know again that's something that we have developed as a social custom, because menstruation is a physiological phenomenon. There is no need to worry at all. But where probably she herself feels or the community feel that she should not be attending, in an entire lifetime, maybe once or twice, yes, it can be done. But I would not encourage it.
Yes, ma'am, noted. Intimate hygiene products are widely marketed these days, but are they safe for daily use or can they cause harm sometimes by disturbing the natural cycle?
When you're talking of these products, I guess you're referring to the hygiene products that are used. Yeah, generally we don't encourage it again because really there's no need. I mean, every single person we assume is hygienically, they take care of themselves. A regular bath once or twice a day, and it's more than enough. Even the regular soaps that are used, or the shower gels, they are more than enough. There is no need to go and use other antiseptics or antiseptic containing products. There is no need at all. There's no need to go out of the way to menstrual hygiene in a big way, because I think generally an average person is quite clean and they maintain themselves. Now, why don't we encourage it? Because a lot of these can be a little corrosive. Now, the skin around the vagina, the vulva, as we call the area, is a very sensitive skin. So, any of these things can actually cause damage to the skin. So, long term use can actually denude the skin. There can be very minor microscopic abrasions, giving rise to infections. So, there's a lot of potential for all this. So, I really wouldn't advise any of those at all.
Are there any specific food choices that can help reduce the discomfort during menstruation?
Generally, there's no specific food. I think eating healthy throughout the cycle is most important. No, nothing specific, but easily digestible food, because generally you may restrict your activity at that time because of the discomfort of the menstrual flow. Other than that, nothing else.
Is it normal to have extreme fatigue during menstruation, ma'am? And can stress or anxiety really delay or even stop our periods? If yes, how should we handle that in a healthy way, ma'am?
Exhaustion, a feeling of tiredness definitely will be there, because there is a menstrual flow. It's not something that's happening during the rest of the cycle. So there will be some degree of exhaustion, but again, as I said, it's the attitude towards it. Now, if you have to go to work, if you have to go to college, then there is no way you let that overtake you. So it's not a major problem and should not be a major problem either. Now, the other question is, I think you were talking about the stress and the thing, whether it can affect. Again, not to a large extent. Long term, long short, it might, but not on a like short term basis. No, it will not.
What are the general do's and don'ts with respect to menstrual hygiene, ma'am?
That's a very good and important question, because one, as I just told you a little earlier, there is no need to go out of our way to maintain a very clean, it is normal, it's normal there. And discharge from the vagina again is a normal phenomenon. Right. So how do we take care of that? Now, when many women, girls worry, because when there's a lot of white discharge, they get worried whether there is something wrong, whether it will become a cancer. These are the concerns. So to begin with, as the cleanliness part of it can be maintained by the general soap and water that we use, clip the hair short. Never shave, never use hair removing creams, never wax in that area. So just trim the hair short or clip it short. And if some girls have an excessive white discharge, what they can do is wear panty liners. So these panty liners will just absorb the discharge that comes, so that irritation, that itching will not be there. Cotton panties always, and loose fitting clothes as far as possible. If you have to wear tight leggings or jeans, then the minute you go back home, try to get out of those and wear loose fitting clothes, because that area of the skin needs a lot of aeration. Now, skin over here is exposed to air. So, there is a lot of breathing for that tissue. Whereas in that particular area, it is completely enclosed. So, we need to give time or space for that skin to breathe. So, loose fitting clothes, cotton clothes as much as possible. I mean, we all live in hot, humid Chennai. So, cotton clothes as far as possible will be more than sufficient. You don't need anything more than that.
Yes, ma'am. In today's world, the term PCOS has become very common. What lifestyle changes and preventive steps should one follow to reduce the risk of developing PCOS or to stop it from worsening, ma'am?
Okay, I'm glad that you use the term PCOS, because that's the current terminology. It used to be regarded as a disease or a disorder at one time, but now we know it's just an accumulation of all the symptoms that the girl feels. And these symptoms are generally menstrual irregularities, irregular cycles. They can have abnormal hair growth on the upper lip or the chin. They can have abnormal hair fall. For example, the male type of hair distribution. So, hair fall can also be an issue. Acne or pimples they can develop. Then they also can put on a lot of weight. So, all these together is known as PCOS. Now, it is not something that we develop, it is something that we are born with. So, this tendency to have PCOS is something that's there. So, when we attain menarche, it starts surfacing. Surfacing generally as we put on weight. So, weight gain is one of the main causes for the PCOS surfacing. Now, if it comes up, again, the bottom line is weight loss. So, to answer your question, can we prevent it? We can't prevent it, but we can control it. Again, we can't cure it, but we can control it. So, when we want to control, what is PCOS? Basically, it's a hormone imbalance. So, there are a lot of hormones circulating in our body, male hormones, female hormones. They are all in harmony, and that's how the system generally works. So, if there is an imbalance, then it results in any of the conditions or one or more of the conditions that I told you. When this happens, you have a full blown picture of PCOS. So, by weight loss, we can actually control this imbalance, and PCOS can be kept well under control. Now, the symptoms I told you are generally what a young teenager or a young girl thinks about. But the family itself is worried about PCOS, because as she grows older, there can be a delay in her having a child. As she grows older into her 40s, things like hypertension, blood pressure, BP, sugar, all this can come up. So these are all long-term concerns of PCOS. So it's not just that, you want to look beautiful so you control yourself. No, PCOS has very, very long-term implications, and it's a major public health issue now, right now.
What are the most important things young people should know about maintaining good reproductive and menstrual health, and how can we clear the common myths or misconceptions about it, ma'am?
So I think a lot of what you have asked actually has been covered by us. Menstrual health reflects finally to a positive attitude, knowing that periods are something that a woman will go through every month or every cycle. The bleeding that can be heavy, the pain that can be present are all part and parcel of this. And the fact that if she feels she cannot cope with it, help will be given by a gynecologist. She can go and meet someone who will investigate her, make sure there are no major issues, and give her relief from all this. So there is absolutely no reason for us to think that this is a burden. It is part and parcel of a woman's life, and hygiene or menstrual health, the cycles, everything can be well controlled by the woman so long as she equips herself with the knowledge about it. That's all that's required.
Yes, ma'am. Absolutely. What are the warning signs in period flow, that is too heavy or too light or even clotting, that should not be ignored? Does the weight of the person have an impact on the menstrual health, ma'am?
The symptoms, as I told you, one, a woman need not necessarily have a 28-day cycle lasting for 3 days, right? She can have bleeding which lasts for 5 days or 7 days, but so long as it's tapering in flow, it doesn't matter. A woman can have cycles that are regular every 21 days, every 25 days, or even 35 to 40 days. So long as it's regular, that's fine. Now, when we get worried is if she has a 25-day cycle for 2 cycles, and then 30 days, and then suddenly it goes to 5 to 6 months, and then comes back, or it is always delayed, like for example, every 3 months, 4 months, some even go for 7 to 8 months without a period. Now, those are situations where they have to see a doctor, have to get investigated, and then take treatment for it. So, it's something that, apart from this, the blood clots itself. Blood clots, as I told you much earlier, is an indication for us that the menstrual flow is heavy. So, only when there's heavy menstrual bleeding, the woman will get clots. Other things they need to be worried about are if she has spotting before a period or soon after a period, or spotting in the during the period itself. We call it intermenstrual spotting. Now, any of these conditions, you have to go and see a doctor. You can't ignore it. So, any irregularity from her own routine is something she needs to take help for. Weight gain, like PCOS and weight gain. Yes, what happens in weight gain or what happens in obesity, as we call it? Now, there is a lot of fat tissue. We call it adipose tissue. There is a lot of extra hormone being produced in this fatty tissue. So, a woman has her own hormones which are cycling. Over and above that, you get this additional hormones coming from the ovary. So, there is bound to be an imbalance. So, that is how obesity or excessive weight gain impacts menstrual cycles. And that is also the reason why weight loss or shedding off whatever excess weight has been put on will set right the menstrual cycles again. So, obesity, apart from multitude of other problems, will definitely cause irregularity in the menstrual cycle.
Thank you, ma'am. I'm sure that our students have gained essential insights from our conversation. That concludes part 1 of our session with Dr. Jaishree. This session was brought to you by the Student Ministry of Health and Hygiene, M.O.P. SANSAD 2025-26.